When you retire from federal service, one of the biggest healthcare questions you'll face is how FEHB and Medicare work together. Do you need both? Should you drop FEHB, or should you just stick with the coverage you already have? Let's break it down simply. If you keep FEHB into retirement, your coverage doesn't change. You'll still have access to the same plans, and the government will continue to pay the same share of your premiums. The question is whether to add Medicare when you turn 65. Medicare Part A is usually a no-brainer. It's free for most people, and it helps cover hospital costs. Nearly all federal retirees enroll in Part A as soon as they're eligible. The bigger decision is Medicare Part B. This is the part that covers doctor visits, outpatient care, and preventive services. But unlike Part A, Part B has a monthly premium that you pay directly. And for higher income retirees, those premiums can be several $100s per month per person. So, do you need Part B if you already have FEHB? Here's how many federal retirees think about it. If you keep FEHB only, your plan will continue to cover doctors, outpatient visits, and prescriptions. You may pay higher deductibles and copays, but you avoid the extra Medicare premium. If you enroll in Part B and keep FEHB, the two coverages work together. Medicare pays first, FEHB pays second, and in many cases, your out-of-pocket costs are close to zero. The trade-off is that you're paying two premiums, one to Medicare and one to FEHB. Some people decide to drop FEHB once they sign up for Medicare. But here's the risk. If you cancel FEHB, you can't re-enroll later. A safer option is to suspend FEHB if you want to rely mainly on Medicare Advantage, TRICARE, or CHAMFA. Suspension means you can reactivate FEHB in the future if you need it. So which is the right move? There's no one-size-fits-all answer. If you want the broadest protection and lowest out-of-pocket costs, many retirees keep FEHB and add Medicare Part B. If you're healthy and want to keep premiums down, you might stick with FEHB alone. If you want to try Medicare Advantage, suspension is safer than cancellation. The key is to think about your health needs, your budget, and your spouse's coverage if you have a family plan. And remember, what you choose at 65 could affect you for decades. If you're approaching retirement or Medicare eligibility, start comparing the costs now. Look at your FEHB plan's coordination with Medicare, estimate your Part B premiums, and run the numbers for your household. If this was helpful, make sure to subscribe, share this with a fellow federal retiree, and visit federalpensionadvisor.com for more tools to maximize your benefits.